Okay, what are some tips for people when they're wanting to communicate effectively with an individual who has substantial hearing loss?
Oh, that's a great question. The number one thing is don't yell, don't raise your voice. The best
Okay.
thing is go to a quiet room and look at them directly in the eye so they can see your entire face. But the thing that most people do is they speak very loud, and that is just
Yes.
annoying and often insulting to the person with
Yeah,
hearing
and
loss
not
Yeah.
helpful.
and not helpful,
Condescending.
and slow
Yeah.
down. I speak very rapidly. I was raised in New York, and if you didn't speak rapidly, you didn't eat. So all of us from New York speak very quickly. But the best thing to do for somebody with hearing loss is to slow it down and to more clearly enunciate and pronounce each word. Most people don't do that. Most people speak in an effective manner for that particular moment in time. They don't really concentrate on delivering maximal communication.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Today's episode is so informative and so important. We are talking about hearing health, trends, and hearing aids, cochlear implants, misconceptions about hearing aids, how to choose a great hearing aid. These are all subjects we're going to cover.
I mean, they're all about just sustaining a really good quality of life for as long as you possibly can. And our
Yes.
expert today is Dr. Douglas Beck, who has been in the field of audiology for more than 40 years. Right? And he has a doctorate in audiology from the University of Florida. I can't wait to talk to him and get his expertise.
Yes, me too. Dr. Beck, it is so good to see you.
Thank you. I appreciate that.
Thank you for joining us today. You are our expert in all things audiology today. We're going to be talking about hearing health, trends, and hearing aids.
Great.
Why did you decide that you wanted to get into the field of audiology in the first place?
Well, audiology is kind of a mixture of medicine and sound and music, and all of that was very attractive to me. I am a professional musician, and when I started my career, I had the good fortune of being at one of the most advantageous audiology programs, which was State University of New York at Buffalo. Back at that time, my chairman was a very famous audiologist, Dr. Jack Katz, and I learned so much from him. He, to this day, is my mentor.
You mentioned this briefly that you are an author, but you are not just any old author. You are a prolific author with 248 published articles and more than 1,000 professional presentations, interviews, and op-eds in audiology. That is a real commitment to audiology like I've never seen before. Why are you so passionate about this?
Well, about 80 or 90% of everything you learn in life, for most of us, comes in through your ears. And it's not just a matter of hearing, because hearing is just perceiving or detecting sound. It's a matter of the ability to listen, which is to assign meaning to sound. And this to me was an early experience that I wanted to be involved with, because it crosses over between science and math and music, and all of these things come together when you study audiology.
Now, talk to us a little bit as far as audiology and the trends that have changed
Yeah.
since you first began 40 years ago.
Well, 40 years ago, all hearing aids were analog. And so that changed about 25 years ago when everything became digital. But early on in digital hearing aids, what we did is we replicated analog hearing aids because we didn't know what else we could possibly do. But now we're at this level where hearing aids are just about the most sophisticated devices you can imagine. I mean, we are so far past digital. Many sophisticated hearing aids now use what's called deep neural networks. An example of a deep neural network is you speak into your phone, you say, "Hey Siri, what time is it?" And Siri breaks through your accent, your gender, your vocabulary, and she tells you what time it is. That's not just a digital improvement, that's a smartphone, right? And it's called smart for a reason because it can interpret, maybe not at a conscientious level, but it can make sense of what you're asking and it can answer. And there's no limit to what artificial intelligence can do now. So with hearing aids, we started having artificial intelligence, 15, 18 years ago.
Really?
Yeah, and now it's come full circle where it's leading in technology. So a deep neural network A good example, you can go to Google, you can arrange your photos. I could just take a photo of your face, and then I could say, find all the photos of Melissa, right? And there they are. And there's, 50 of them or 5,000 of them, whatever it is. So it'll arrange that. It'll take a simple command from your voice and arrange your digital world into that. So hearing aids, now we can use advanced noise reduction. There are some hearing aids that are trained on human voices. I'll tell you more about that. Right now, most deep neural networks are trained on individual unique speech sounds called phonemes. So if I say the word dog, dog has 3 phonemes. It's d, aw, g. So those sounds, and you can train hearing aid deep neural networks on thousands, if not millions, of individual phonemes, and then the hearing aid is looking for that and just amplifies that. So you'll get less noise and you'll get more power added to human speech. In a few years, you'll be able to say, okay, let's go out and have a meal. We'll go to a restaurant. And maybe because I have substantial hearing loss, I'll say, Melissa, before we go out, I want you to just recite the alphabet. So you recite the alphabet, and now my hearing aid just knows to listen for your voice, and it won't amplify all the
Oh,
others.
that's incredible.
Wow.
Yeah.
Wow.
I published an article on that. It's a peer-reviewed article probably 5 or 6 years ago with some of my colleagues in Denmark. And that's the type of technology that hearing aids lead in. Now, that's not commercially available now, but it wouldn't surprise me if that type of technology is available in about 3 years. And hearing aids just keep getting more and more sophisticated, and they focus more now on speech sounds. So we can take steady state noise like a fan, a 60-cycle hum from a refrigerator, and we can really attenuate those. We can reduce those sounds quite a bit. But human voices, it's hard for the hearing aid to know which human voice you want to pay attention to. So many people will wear hearing aids in a restaurant, a cocktail party, an airport, and they'll say, well, it was really difficult to understand what people were saying. Well, yeah, because the hearing aid doesn't actually know who you're trying to listen to. Particularly, at Thanksgiving dinner, and people will have a notoriously difficult time there because you'll have 18 people speaking all at the same time. The thing to understand is nobody does well in that situation. It's worse with hearing loss, but there's no person who's going to do well when 18 people are speaking.
I see. That's normal then, in other words.
Yeah.
To a certain
Well,
extent.
your answer just blew my mind because I didn't even know that was something that you
I didn't
could
either.
do with a hearing aid or really any device, having a smart hearing
Yeah.
aid, if you will. What's your why, though? I mean, the technology's really cool, but why? Why is it so important to you to see these advancements in these 40 years, more
Yeah.
than 40 years of being in this industry?
Well, audiology is, birth to death, right? Cradle to grave. And early on in my undergraduate studies, we had a lot of children that we studied who had all sorts of disabilities, not just hearing loss, but other, birth problems. And you would see how the quality of their life was very, very difficult, and it wasn't satisfying for their mom or their dad or the person who was taking care of them. And then you realized that so many of these kids, they had very substantial hearing and listening problems. And you would see how devastating that was as far as language development, as far as career choices, as far as social relationships. And all of a sudden, it became very, very important to understand that to a very deep level. And essentially, we all start with studying hearing, and we stay focused on that because there's a lot to know there. But then when you get involved with listening and speech and noise, these are what I refer to as whole brain events. So hearing, you have an ear, you have the 3 little bones, malleus and stapes, you go to the cochlea, sends a signal up to the auditory nerve, up to the both sides of the brain, the superior temporal lobe. So, and the contralateral pathway is stronger, which is why, for many people, when they're trying to listen to a particular signal, like a phone in a noisy environment, they'll put it up to their right ear without thinking about it because it's a well-known right ear advantage for processing language in your left hemisphere. So then when you're adding in speech and noise and you're adding in listening difficulties, bad acoustic environments, it's easier for your right ear to make sense of speech. But there's more to life than speech sounds. There's all the sounds in the environment. And when you start to add in these difficult, challenging listening situations, we're depending on the person's frontal lobe to make executive decisions. We're depending on their amygdala, which is their emotional center. We're depending on their hippocampus, which is their memory center. And of course, everybody has an accent. Everybody has a vocabulary. Everybody has their expressive ability. And when you think about normal hearing and normal vision, so you have a redundant signal. I can speak to either of you, look at you, and because of your body language, your facial expressions, it used to be called lip reading, remember that? But it's actually speech reading, because it's not just your lips, right? You can see vocal movements in your larynx. You can see when I raise my eyebrows to emphasize a point. You can see, the formation of words and information on the person's face and gestures and all of that stuff. So it's much, much deeper than just press the button when you hear the beep. The thing about press the button when you hear the beep is it almost doesn't matter. You only need about 15 or 20% of your auditory fibers to be intact, and you're going to press the button when you hear that beep. It doesn't take many fibers to transmit that beep. However, to listen takes a full complement of sound, of auditory fibers. Yeah, so people will say, I passed a hearing screening, and they're still having tremendous difficulty. And lots of professionals say, hearing test is normal. That's not enough. It was never enough. That's the whole idea of hearing screening. The only screening I endorse is newborn infant hearing screenings.
Okay.
Right? At birth, you've got to be tested. But even if you pass that, if you have cytomegalovirus, which is a very common viral infection, you could be 18 months old and actually be deaf. You were normal at birth, and now you're deaf because of CMV. So passing that screening test at birth is very important, but that doesn't mean you're done. You should be tested a couple of times as a young child before you get to school. And then, regularly, every couple of years would be nice. Mm-hmm. We don't do that in America. Most children now get screened at birth.
And then for kindergarten, right?
Well, sometimes, maybe, sort of, kind of. But they're not testing the kid's auditory processing ability.
Right.
They're not testing their speech and noise ability. They're not, because they're doing screenings.
Right.
And screenings tell you almost nothing. It tells you they could press a button when they heard a beep, but it doesn't tell you anything about processing.
Sure. Well, it's just like you said, I remember in the pandemic when we were wearing masks, I had a hard time hearing.
Oh, sure.
Because I didn't realize how much I read lips. It was really challenging.
Absolutely.
You read language.
Yeah,
right.
Language, exactly.
Well, and there was a cool thing that happened during the pandemic was masks started to come out that have clear plastic here.
Yeah.
So you could actually see the person.
I tried those.
How'd that work for you?
It got fogged up really easily.
Oh, okay. So they work for a lot of people. But that's the thing, is that when you get from hearing to listening, you go from a very finite thing, which is hearing, to an infinite thing, which is listening. So.
One of the technological advances that you mentioned, I've seen a member of my family use it this way. She has a custom fitted hearing aid.
Yeah.
And it's so tiny. It is also Bluetooth.
Right.
That's a recent advancement.
And are there Bluetooth devices that aren't the custom fit?
Oh, yeah.
Yeah, it works both ways. So Bluetooth in hearing aids has been out there for about 10 years.
Oh, okay.
It was one of the earliest places we used Bluetooth. And it's a wonderful thing because I can listen to any music on my phone and I stream it to my hearing aids.
That is
And I do
incredible.
wear hearing aids that you can't see. They are called IIC, invisible in the canal. And if you were to look at my ear canal and if I were wearing them, you wouldn't see them at all. Wow. But I wear them in very challenging situations to improve my ability to understand speech and noise. And so these technologies like Bluetooth are not just useful for streaming music, but your phone automatically goes to both ears. And people are shocked when they start listening to their phone through both ears. It is so much easier. It's day and night. Yeah, with or without hearing loss. Most of the time you take your phone and you put it up here. But when you are wearing hearing aids, and virtually all the major manufacturers and some of the OTC manufacturers have Bluetooth as an option.
Over the counter.
Yeah, and Bluetooth is always a good option for hearing aids. Some hearing aids are made without them. My invisible in the canal hearing aids are so incredibly small they couldn't put a Bluetooth processor in there.
Oh, okay.
But because I chose that, because there is, without a doubt, a hearing aid stigma. A lot, only 10% of the people with hearing loss wear hearing aids. And that number is from the Global Burden of Disease study, which came out in 2024 in Ear and Hearing. And they said there's 70,000 people in the USA. So 1 out of every 5 people in the USA has hearing loss, but only 10% wear hearing aids. And I think a large part of that is the classic enduring stigma associated with hearing aids.
Oh, yeah.
In general, and this is not my opinion, this is what the research shows, that wearing hearing aids makes you look 10 years older and probably have a lower IQ and probably less competent.
What?
That's, I mean, you could just go to WebMD and you could look up hearing aid stigma, see what they say. But
That's a darn shame.
Well, and it's
it
probably
really
the
is
opposite
in
because
2024.
the hearing aid makes you sharper, actually.
Yes,
you know?
It does, but
Exactly.
90% of people with hearing loss won't wear them.
Oh,
Now,
man.
here's a funny thing. A colleague of mine, Dr. Amlani, wrote years ago that even if hearing aids were free in the USA, most people wouldn't wear them.
Get
Really?
out.
Yeah, so when you think about, well, is that real or
Yeah.
it's pretty real.
You're
Most people.
expert. I mean, you've seen it. You know.
Yeah.
You,
And there are many studies. The American Academy of Otolaryngology Head and Neck Surgery released a study. I think it was two of my friends, another paper by Dr. Amlani and Dr. Michael Valente. I think it was 2017. And what they showed is roughly in the USA at that time of candidates, they said about 1/3 of the people who would benefit from hearing aids could wear them. And we said, well, but the USA is the most expensive place to get hearing aids, so that's probably the issue. Well, it turns out that in the EU and the UK and New Zealand and Canada and Australia, where hearing aids are free for
Totally free,
citizens,
right?
yeah, you know what percent wear them?
Less.
40%.
Oh, really?
So,
Oh,
but the point is 60% don't.
wow.
Right? So they're free.
Right.
So the point is they are just not something that people want.
So that's universal.
It's universal.
It's not just us.
So
Okay.
when you look at the literature, it was never serious. I mean, listen, price is important. Price is important in everything. The food you eat, the clothes you wear, the house you live in, price is important. I'm not saying it isn't. But I'm saying that even when hearing aids are free, 60% of the people who have them available don't want them.
Still don't want them.
So I don't think price is the real big issue. I think the biggest issue is hearing aid stigma, is how it makes people appear. And that's why I really advocate for custom-made hearing aids so that they fit deeper in your ear, which makes it more cosmetically pleasing, but also easier audiologically. Because when you have the hearing aid, the tip of it is deep in your ear, you get much better directionality, because this part of your ear is called your auricle or your pinna, and it faces forward. So in a natural hearing ear, you have more information from in front of you than behind you. So you get that. As you get closer to the eardrum in smaller, tiny hearing aids, you need less power, less gain, and what that means is less whistling. You know how hearing aids sometimes they go,
Yes. They used to whistle.
right, but if they're deep in your ear canal, you have less power. The reason that they whistle is called feedback, and what that is the sound of the hearing aid leaking and going around and around and around, and you get a feedback loop.
Mic feedback.
Yeah, so you could, it's exactly the same thing. And with a microphone feedback, what you often do is you just turn it away from the speaker, right? So then it's not getting the same signal. So the advances in hearing aids are tremendous, and we're not done. It's not like there's a finish line. It's that every
Just
year.
keeps improving.
Yeah.
It keeps improving, and they
Okay.
get smaller, and they get more sophisticated and more useful.
And more affordable.
And more portable and more affordable, and most of them now are rechargeable. You know, it used to be that
that's
they
cool.
were primarily disposable batteries, zinc air batteries, which are very inexpensive. I think you can go to Amazon and probably buy a package of 40 of them for probably $10, and that would probably last you most of a year. So the battery was never very expensive, but they are toxic. So rechargeable hearing aids are kind of cool because you have a little box and you put the hearing aid in there and it recharges. You don't take the battery.
It's like your AirPods.
Yeah.
Yeah,
like
it's,
your AirPods.
exactly,
AirPods.
exactly.
What are some of the popular hearing aid brands and their unique features?
I would hesitate to mention brands.
Okay.
But the features that I think most people would look for, good noise reduction, deep neural networks, directional hearing aids, and custom hearing aids. Now, custom hearing aids are often going to cost more because they take an impression of your ear and then they build the hearing aid to fit your ear. So it takes more time, it takes more talent, it takes more molding ability, it takes a deeper canal impression, which takes its own set of technology and processes. But I think it's almost always worth it. I can tell you I've worn, I don't know, at least 20 or 30 different, hearing aids in the last 40 years. And the ones that are the most comfortable and sound the best are the smallest ones that fit deepest in my ear. Now, that's me. That's not true for everybody. But I think when we use generic or over-the-counter, that's never the best for anybody, with rare exception. There might be some people who, oh, it's the very best. But for most people, you want it to fit their physical ear canal, and you want it to fit their exact audiogram.
Customized.
Yeah.
What are
and-
some of the factors that someone should consider when they're choosing what kind of?
Well, it's not so much about choosing the specific hearing aid, it's about choosing the particular provider, right? So you want to get somebody who your friends, your family, maybe your doctor has referred you to, whether it's a hearing instrument specialist or an audiologist. You should ask this question, very important question. Do you practice to best practice standards? Now, there are 3 national bodies that produce best practice standards, and they're all about the same. So the American Speech Language Hearing Association, the American Academy of Audiology, and the International Hearing Society. Those 3 groups have best practices, which all say this. You do your diagnostic tests so you know what's going on with the patient, but then you also do speech and noise tests. And then you also do listening and communication tests. And those are particularly important because most people with hearing loss have what's called a mild loss. They don't know they have it. 70% of them don't know they have it. So they're not going to look for a solution to a problem they don't
That
perceive.
they don't know they have.
Right.
And this is very common because what happens is as you age and you have age-related hearing loss, and as you have more noise exposure because you're aging in an industrialized society, your hearing gets progressively worse over the years. But it's a slow process, and so people don't notice it. All of a sudden they do notice they're asking for repetitions. They're asking their spouse or their significant other, what did he say? Right? And that
Yeah.
goes on all the time. And it's not because people are mumbling, and it's not because people are not speaking clearly. It's because you are now in your 50s, 60s, 70s, 80s, 90s. Your ears are just about the same age as you are. and as we age, we develop what's called a high frequency loss. So you don't hear the parts of speech that tell you what the word was. For example, the s, t, ch, those sounds, those are fricatives, and they're very, very high frequency. They're 5, 6, 7, 8, 10,000 hertz. As you age, that's the part you lose first. So 80% of the intelligibility of speech comes from the high frequencies, but 80% of the power of speech comes from the vowels. So people will hear other people speaking, and they'll say they weren't speaking clearly, I couldn't understand them. That's probably not it. It's probably you have the power of the speech, you could hear the vowels, but you couldn't hear the consonants because of your high frequency loss. So it sounds like they're mumbling.
Is that why people with higher pitched voices like myself? I just remember my grandfather always being like, what? I can't hear you. But he could hear like my brother, for example.
Well, that wasn't
Or is
you.
that-
That was probably your grandfather, and probably your brother was closer at that moment in
Okay.
time.
It wasn't my high voice.
Yeah, the thing about high voices, so children have the highest voices, but they're not remarkably higher than an adult male voice. Male and female voices, it's called the fundamental frequency. They're not grossly different. You know, they're within a few, almost always less than an octave apart. Okay. So I have a low-pitched male voice, so my fundamental frequency is somewhere around 150, 160, but I'll bet yours isn't above 225.
Oh.
So they're not really that different. And when you think about the fundamental frequencies of human voices, there's a couple of things to know. Number one, your ear canal has a resonance, a natural acoustic resonance. Male ear canal resonance is about 2,700 hertz. So I hear 2,700 hertz louder than any other frequency. Most women have an ear canal resonance of about 3,100 hertz.
I believe it.
Yeah.
Right? So men and women, Mars and Venus, they really do hear different things, but it's not remarkably different. They're very, very similar. And voices in adults don't vary that much. Okay. I mean, yes, there's going to be somebody with an extraordinarily high-pitched or low-pitched voice. Was the guy who did the narration.
Is it Keith Morrison from Dateline, who's way down
Yeah,
here?
well, he's a good example. He's a good,
Yeah.
But you notice him because he is exceptionally low-pitched voice, but
Right.
most people aren't. Most
Right.
people, the standard deviation on that's pretty small.
Wow.
Yeah.
We've talked about quite a bit about the technology advancements that you've seen so far.
Yeah.
What's on the horizon for hearing aids?
Yeah, on the horizon for hearing aids is all miraculous stuff. It's taking deep neural networks to the next level. It's having rechargeable hearing aids that can go, 3 and 4 weeks on a charge. It's making them so incredibly small that they're barely visible if you look at the ear. And most people don't look at your ear unless they see a distraction, like a hearing aid. And then, that's unfortunate because when you think about all the things we do as we age, right? Some people do hair transplants, some people do implants, some people do
Facelifts.
facelifts, some people do, anything with their eyes. You can do laser correction for near and farsightedness, right, with LASIK surgery. And these things are great, and none of them are cheap. And it's important, though, that you have something that is cosmetically appealing. All of the things we just mentioned, as well as Botox and fillers, nobody does that because it looks bad. But, people do these things, and they do it to enhance the way they look. Nobody goes out there and voluntarily says, hey, look at me, I have a scar over here. People don't do that. They try to cover that scar. And it's an important revelation. We could, as an industry and as a profession, we could keep making hearing aids that people are not looking to wear, or we could change it up and be more patient-centric. And Einstein said, I guess it was in 52 or 53, the definition of insanity is doing the same thing over and over and expecting a different result. Well, as long as we make products that are unacceptable for the wearer cosmetically, they're not going to do it.
They're not going to wear it, yeah.
People do the opposite. They go for things that enhance their cosmetic appeal.
That makes
and
sense.
I'm not saying that's good or bad. I'm just saying that is the way it is.
It is what it is, yeah. What are some of the advances in cochlear implant technology for severe to profound hearing loss?
So cochlear implants, most people are kind of shocked when I say this. They started actually in 1957-58. That was the first cochlear implant. And then just up the road here in Los Angeles, in 1960-1961, Dr. Bill House implanted 3 people with cochlear implants. So we've been doing cochlear implants now for about 65 years. They were FDA approved in '86 for adults and in 1990 for children. And what's happened is when we started doing cochlear implant research, before I got to House 40 years ago, but when I got there, we were doing analog cochlear implants with single ball electrodes. And now cochlear implants are incredibly sophisticated. They have electrodes that can be dozens of electrodes, and that allows us to stimulate particular parts of the inner ear. The cochlear implant recipients vary tremendously. Back 40 years ago, you have to be deaf. You had to have 110 decibel thresholds. The definition of deafness is 90 or greater, 91 dB or greater hearing loss. So back in those days, 40 years ago, we would only implant people at 110 or worse thresholds. That means they couldn't hear thunder. That means they couldn't hear you yelling into their ear. That these people had absolutely no hearing. So we went from that, where cochlear implants were an aid to speech reading at that point, and they allowed you to have sounds so you could alert. Somebody would honk a horn, and you have a cochlear implant, you'd know there was a sound, you'd look around for it. Now, I am very comfortable saying that most people with cochlear implants, 6 to 12 months after they get their implant and they get programmed, they can probably use a phone without assistance. A very good friend of mine, Dr. Ashley Brogan, up in Ontario, Canada, has 2 cochlear implants, and I only tell you her name because she's all over social media and all over the internet, and she's brilliant and she's wonderful. She's one of the few audiologists that has 2 cochlear implants, and I speak to her on the phone all the time. We lecture together all the time, and you wouldn't even know she had hearing loss. So cochlear implants have come a very, very long way, and they're not done. They keep getting better every year. The next thing for cochlear implants, you'll see it this year, next year, the year after that, next 3, 4, 5 years, subdermal microphones. Because right now the cochlear implant looks like a hearing aid, and it has a magnetic part to transfer information to the implanted part from the processor. But what we anticipate will happen in the very near future is you won't need an external microphone. The microphone could be placed under your skin, or it could be placed in your middle ear, so that the acoustic energy from the real world gets to that microphone without having that microphone exposed to the external world.
And then, aesthetically, the cosmetic difference would be
Yes.
really profound.
Yeah.
Yes, it would.
Wow.
It would.
Are there steps, or is it even going to be possible one day to actually repair the ear and do you know what I mean?
Yeah, there's all sorts of research that has been done. A lot of it came from the Navy decades ago on how we might repair outer hair cells. And there's been all sorts of chemicals that have been tried and all sorts of things. There are some new movement on repairing hair cells. The problem is if you take somebody who has had significant hearing loss for decades And even if you could regrow their hair cells, the problem is, how do you hook that up to the auditory nerve? How do you hook up the auditory nerve to the brainstem? Because those fibers die off when they're not stimulated, and they change over time. It's interesting that many birds can regrow outer hair cells.
Really?
And you and I can't. So, and they can also fly.
Well, there's
we can't
also
do
that.
that. Yeah.
There's
Yet.
also-
Yet.
Yeah.
Can't do that yet.
That's also on the horizon.
Yeah, jetpacks.
Okay, what are some tips for people when they're wanting to communicate effectively with an individual who has substantial hearing loss?
Oh, that's a great question. The number one thing is, don't yell, don't raise your voice. The best thing is, go to a quiet room and look at them directly in the eye so they can see your entire face. You know, a lot of men in 2024 have beards, including myself. But that used to be a big issue. People used to say that it's very hard for me to follow the conversation of somebody with a beard, but it's specifically the mustache, right?
Because it's covering.
Yeah, and
okay.
exactly. And so the thing is, you know, obviously you just keep it trimmed so that if your spouse or your significant
That makes
other
sense.
has hearing loss and they're looking at your face to get the redundant visual cues, make it easily available.
Yeah.
But the thing that most people do is they speak very loud, and that is just
Yes.
annoying and often insulting to the person with
Yeah,
hearing
and
loss.
not helpful.
And not helpful,
Condescending.
and slow down. I speak very rapidly. You know, I was raised in New York, and if you didn't speak rapidly, you didn't eat. So all of us from New York speak very quickly. But the best thing to do for somebody with hearing loss is to slow it down and to more clearly enunciate and pronounce each word. You're both really expert, you know, at pronouncing words and at delivering a visual and an auditory signal because you pay attention to that. That's what you do for an occupation. Most people don't do that. Most people speak in an effective manner for that particular moment in time. They don't really concentrate on delivering maximal communication.
Well, you just gave us some tips for people who haven't been doing that to learn how.
Exactly.
And now it's time for Ask the Expert. This is the portion of the podcast where people who listen or watch our Care Experts podcast get to ask you, our expert, a question anonymously. Here's the first one.
Make them easy.
What are some signs that I may need a hearing aid? And how do I know when it's time to see an audiologist?
Okay, so the first thing is most people, 98% of people with hearing loss need 2 hearing aids. They don't need 1.
Okay.
Hearing in one side is miserable.
Right.
Makes it very hard to tell where the sound is coming from, and it's never going to be balanced. You have 2 ears because you need 2 ears. Your brain is constantly comparing and contrasting the sound from your left and right ear. That tells you where the sound is coming from. That tells you how far away the sound is, and that makes it much clearer to understand speech and noise. So you need 2 ears, you need 2 hearing aids.
That makes sense.
First sign and symptom is you realize that you're not hearing clearly. You are asking everybody around you for repeats. You're asking what was the punchline to the joke. You're depending on other people to communicate for you because you're not participating. And it turns out that's very bad for your brain, and it's very, very bad for your relationships. It causes anxiety, it causes depression, causes social isolation.
That's not good. So at what points do you decide, okay, it is time to see an expert, a specialist?
Yeah, I always say this. I don't believe in screenings, hearing screenings at all. I think it's an utter waste of time and money. And people who get free screenings, it's worth exactly what they paid. You know, you need, if you have any audiologic concerns, any hearing concerns, any listening concerns, you need a comprehensive audiometric evaluation. That's what it's called. That's when we test press the beeps, we do speech and noise, we do communication assessments, we do listening assessments, and then we have enough information to tell you good, bad, indifferent, what you should do, what you should not do. When people pass a hearing screening, if you came to see me at my office and I just did a hearing screening, you would go home and tell your husband, I saw Dr. Beck and he said my hearing is normal. That's what happens. But I never said your hearing was normal. I said you passed a screening, and people don't know the difference. So it's very important. No other healthcare professionals do free screenings. You shouldn't expect them, and we shouldn't deliver them. I don't mind if a school teacher wants to do a screening of somebody's hearing. I don't mind if a nurse at a school or something like that is doing a hearing screening, or in a doctor's office doing a hearing screening, just to see, is this essentially normal? That's fine. But when you see somebody with a doctorate in audiology, I can't tell you anything much about your hearing or listening ability based on you passing a screening. And I can't tell you much about you failing a screening. other than, oh, we should do a comprehensive audiometric
Then you-
evaluation.
To give a
Should've done
proper
that anyway.
diagnosis.
Yeah.
Right.
Yes.
And it's the same in all of medicine. Diagnosis first, treatment second. Screening tells you not enough to have a diagnosis, so why are we bothering?
Yeah.
And people say, oh, it's expensive. Yes, it is. Yes, it really is. So is optometry, so is dentistry, so is OBGYN, so is all
But could you
healthcare
pay for them with the CareCredit credit card?
Yes, it allows the patient the opportunity to acquire better processes, products, and professionalism that they wouldn't have access to otherwise. When a patient, there was a great thing by Susie Alma, the financial guru, and she was saying in 2024, she said, most Americans don't have $500 to cover an emergency. So this is very important because most hearing aids, even OTC, to buy two of them is going to cost you $400 or $500, maybe more. They could go up easily to $1,000 each. Hearing aids on average last about 4 to 5 years. I mean, some last longer, but by that point, your hearing has changed substantially, sometimes. And by that time, the technology has certainly improved dramatically. So you take a pair of hearing aids that are 8 or 10 years old, and you give that same patient a brand new deep neural network hearing aid,
Right.
and it's day and night difference. So we don't like to keep patients in old technology.
Right.
It's like having an
like
old
having
car,
an old phone.
an old phone. Yeah, it really is. And hearing aids are
iPhone
almost
8.
always less expensive than phones.
Yeah.
I mean, premium technology can be $4,000, $5,000, $6,000 for two, but you're getting about the most sophisticated product that you own, and it's going to last you 4 or 5 years if you take care of it. It might go 7 or 8 years, maybe 10 years. And most manufacturers of these products warranty them for loss, theft, and damage. So when you buy it, you say, I want a 3-year warranty, and that may cost you an extra couple of bucks. But now, if you lose it, it's covered.
Right.
If you drop it in a bucket of paint, it's covered. If you break it while it's being repaired, they give you a loaner. So it's not just the widget, it's all the care that comes with it. It's the professional diagnosis, it's the professional rehabilitation, it's the professional looking in your ear, it's the professional guiding you. Can you buy OTC? You bet. And for some people who already have a diagnosis and have worn hearing aids and they're picking that because that's all they want or need, that's great. But I think for most people, absolutely see a hearing care professional first and then make decisions after you get a consultation and you know what your options are.
That makes sense.
For those people who, though, are in the majority,
Yeah.
who associate hearing aids with, oh my gosh, people are going to think I'm so old now.
Yeah.
Oh my goodness. How do you even start the conversation to get them in the door for one of these comprehensive screenings?
Yeah,
Or excuse me, comprehensive.
audiometric evaluation.
There you go.
I knew what you meant. But it's not easy. People want inexpensive and fast. People want to take a pill for their hearing loss. There are no pills that are going to make any difference at all. It's not an easy sell, but that's why people like me and my colleagues have a master's or a doctorate, or at least they're state licensed to do this kind of work, because it's very important. Again, 38 to 40 million people in the USA have hearing loss on an audiogram. And then you have another 26 million who have no hearing loss whatsoever, but they have listening difficulty and speech and noise problems. So it's not easy to say to somebody, you should get a comprehensive audiometric eval. People think, oh, I passed my screening, I don't need that. Oh, really? But you're still having trouble.
There you go.
Yeah, but I passed my screening. Yes, but you're having trouble. No other profession would allow that to happen. And I love audiology, couldn't be prouder of audiology. But only in audiology do we do that sort of level of work where we set people out without having investigated the problem thoroughly. And it's a huge problem. Optometrists don't do that. Dentists don't do that. Physicians don't do
Right.
that. A very basic test from World War II, what most people get, it's called air conduction, bone conduction, and basic speech perception testing. That is so outdated, and that is, although important, it doesn't cinch the diagnosis for us. We need a diagnosis so we know what we're doing.
What to do.
And people, don't want to pay. I get that. I don't want to pay for things I don't need.
Yeah.
But when I go to the doctor, I want all of it.
Yeah, of
I don't want
course.
any guesswork. I don't want
Wanna
any
be my best
approximations.
self.
And that's why I said the important question, right, is to ask, do you practice to best practices? Because best practices by all 3 national organizations are very clear that you have to do the work properly to get to the right answer.
Well, and going back to ask the expert, the next question was, what's the difference between in the ear hearing aids and behind the ear hearing aid styles, and how do I choose the right one for me?
The right one for you, we say this often is the one that you'll wear.
Okay.
And even though we can convince many people to get behind the ear and over the ear type hearing aids, that's rarely what they want.
That's right.
They will do it because it helps. They will do it because it adds quality to their life. They will do it because it allows them to hear and to listen. But most of the time, if you said to a patient, would you rather wear this or something that's relatively difficult to see, most of them would prefer the smaller
Definitely.
one. And that's, I think that's very much in alignment with everything else in medicine, particularly plastic surgery, right? People who get facelifts, mini facelifts, people with Botox, people with filler, people with eye correction, people with dental correction. We are all concerned about how we look, and in 2024, that's a very important issue. Maybe in the 1800s and the 1400s, how you looked wasn't really, how you were defined.
There's no social media.
Yeah.
And then it was mostly about functionality, right?
Right.
What can you do? And if you're very, very good at laying down a railroad track, you were very valuable. If you're very good at building houses, you were very valuable. But now, that sort of skill, although still critically important, we value different things in society. And one of the things that we value in mainstream society is physical appearances.
Here's the last question for Ask the Expert. How often should I replace my hearing aids? And what are some indications that it's time for an upgrade?
Well, there are some products now that even though your hearing aids might be getting a little bit old, there are some products that can help revive them. Sometimes you can send hearing aids in for repair, where they'll replace the receiver or the microphone, and you might get another year or two out of them. You might get more, so if the hearing aid is not sounding as sharp and crisp and as natural as it did, sometimes they can be repaired and updated. There are some systems out there, there's one called Redux, which is absolutely brilliant, and it takes microliters of moisture out of the hearing aid, which is almost the same thing as renewing it in many situations. Wow. But in general, if the hearing aid is functioning fine, right, we don't need a new receiver, we don't need a new microphone, the circuitry is okay, it's programmed to your hearing needs, your hearing can change substantially over the years. And the hearing aid that you have, if it was a custom or if it was an over-the-ear type of device, it may be at its peak of programmability, meaning they've programmed it as much as they can. You need to start with a new foundation. Doesn't happen all that often, but it does happen. There's people who are wearing hearing aids that are 8 or 10 years old, and they're sort of maxed out at that point. The circuitry was designed for this level hearing loss, and now you're at this level. So you need maybe to replace it. And what I generally say is everything depends on everything. I mean, it's not that there's only one way to approach the problem and there's only one solution. There's many. And it just depends on the specific presentation of the patient. What's the hearing aid they have? What style is it? How is their hearing doing? How's their listening doing? So we don't want to just swap out hearing aids and give you the next one. We want to give you the next one that is more amenable to your situation.
Thank you so much for
Yeah,
just
this
having
was
this conversation with us,
Yes.
because I feel not only informed, but I feel like it kind of gives me a script for approaching people in my life,
Sure.
family members
Who are resistant.
but then also just being really cognizant of my own hearing and listening
Sure,
abilities
absolutely.
in a different way than I had before we started having this conversation. So thank you so much
My
for joining
pleasure.
us.
Thank you for having me.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.